Yeah, so I'm here to talk about how we treat CLL in India and the geographic diversity of the epidemiology of CLL in India. So it's a bit different from, my background in both in the UK system and the Indian system helped me a lot in this aspect. So it's a bit different when compared to the Western epidemiology and Western management of CLL. It's a bit different in India. So if I look into the epidemiology or incidence of CLL in India, then it's probably much lower than what we see in the West. Whether it's actually a truly low incidence or it's actually because we're not picking up enough cases in India, we still don't know. But there are some studies from UK itself looking into the diversity of ethnic population in UK, again suggesting that there is a low incidence of CLL in UK. And it's probably true in most of the Eastern world, like in China and especially in Japan. Again, the incidence of CLL is quite low. Their health system is comparable to the West, so they may be picking up as it should be picked up in the West. So there will be, the conclusion is that it's probably lower in India also, but we need more solid data before we conclude that. The main problem, again, in India is the lack of research and finding out the actual need for the local population there. So there's a huge scarcity of data from India. So if you type chronic lymphocytic leukemia into PubMed, you'll get around 25,000 articles. But if you confine that to the Indian context, you'll hardly get 150. They're all low impact factor journal articles. So there's a huge scarcity of reasonable data from India. And that's why we don't find specific guidelines for India, because we don't have data. And that's why we diverse, even in India, we diverse in the management of CLL. And when I'm coming to the management of CLL, the actual treatment of CLL, the majority of Indian population, it's not affordable for the majority of the Indian population, and it's even though it's a public-private based system, majority of people are catered by the public system. So there's a huge socioeconomic diversity in India, and majority of people can't afford the treatment. But there are generic versions of most of the drugs that's available in the West. So to some extent, we can still use FCR, BR, etc. But all the newer treatments like ibrutinib, venetoclax, they're all, even though they are available, they're not affordable to the majority of the population. So, and again, the major concern with chemoimmunotherapy is the infection, the risk of infection, and people are reluctant, especially using FCR. So I've done a survey among the clinicians in India. That's one of the highlights in the talk. And even though FCR is the standard of treatment in most of the Western world, Indian clinicians prefer to use BR because the incidence of infection is much less in BR compared to FCR. So, and when I'm talking about the infection, you're looking into infections that's probably not heard in the Western world. The infections that's, the bugs that is completely resistant to all known antibiotics to mankind. So that's why people are scared. And in that aspect, probably newer drugs would contribute a lot. And that's something that I wanted to appeal from the medical fraternity in iwCLL to find a different model for costings for population like Indian population or similar socioeconomic status, which hopefully we will be able to collaborate and work on that.